Welcome to the Clinician's Decision Support Toolkit. We recommend using the Firefox browser, if possible, for the best experience with the toolkit. In this video, I will demonstrate a lot of basic items that you may be interested in using in conjunction with your toolkit and monitoring outcomes for improved patient care. Log into the toolkit using the information you have registered with. If you're having difficulty with any step of the process, feel free to contact Data Center at clinical-informatics.com with any questions you might have. Take a look at your toolkit. Before you'll be able to use any of the outcomes measurement features of your toolkit, you'll need to submit data. The first important thing to know is probably going to be how to print forms so that you can properly submit data. Depending on your organization's setup, online forms may also be an option. The most common method for submitting forms is generally via fax. Highlight the Home tab of your toolkit and select Print Forms. If you have multiple sites, here you can select which site should print onto the form. If you need to change the language of the form that you're printing, that may be an option here as well if your organization has other language forms set up. Once you've customized this information, click on Form Template. Select the form you're interested in using. If you require access to additional types of forms, or forms that are specifically customized to your needs, consult your office administrator and have them contact us. For this example, we will select the standard Adult version 11 form and hit Submit. Now click on the hyperlink it will create to pull up your form. As you can see, the form is now populated with the proper org, site ID, and clinician ID. This information is all very important for when you submit. Without it, the form probably won't show up in your toolkit correctly. Remember to always print forms directly from the toolkit rather than making photocopies of a form. When submitting data, you should typically expect to be able to see the information populate into your toolkit by the next day. In some rare cases, particularly if forms come in with poor quality, forms may require manual entry, which can take a bit longer, but data should almost always be in your toolkit within 48 hours. If data you submitted isn't showing up in your toolkit within this time period, or is showing up with any sort of an error, you should contact Data Center at clinical-informatics.com and let us know so that we can help resolve it. If there is ever any uncertainty about whether or not a form you submitted was processed on our end, check the fax report. It is under the Home tab. This should update to show you information about what was processed. This can only update with information that has been processed, so you should still expect about the same amount of delay from the time that you send it. Once you do have all the data in the toolkit, there are several important things you should be aware of. To start, click on the View All Data button and then click Refresh. Once you have the data submitted, you will be able to track many things using the toolkit. You will also need to make sure that these input fields are all customized correctly for the data that you're trying to view. Make sure that the date range field includes the most recent session date of clients you are hoping to be able to see. If you, for example, set your fields to only be able to see a specific diagnostic group, like ADHD, then your results and summary below will only include clients who fit that filter. We'll begin by looking at some of the summary data. Items such as the severity adjusted effect size, which can be seen here. The severity adjusted effect size provides an estimate of effect size after adjusting for the differences in case mix and severity of symptoms. An effect size of 1 means the patient improved 1 standard deviation on the outcome questionnaire. Effect sizes of 0.8 or larger are considered large, while effect sizes of 0.5 to 0.8 can be considered moderately large. Effect sizes of less than 0.3 are small and might well have occurred without any treatment at all. A few important items to note. When your sample size is too small, the severity adjusted effect size won't be very reflective of your caseload. You'll be subject to a lot more fluctuation than you would with a big data set. You can also see the distribution of patient change here. The distribution of change graph provides information on the percentage of patients who show change on the questionnaires. For more information on these topics, click on the text. Over here you will see the summary statistics, which will provide general information about your cases as seen below. You'll notice each client has several columns off to the right. Youth forms that are filled out by the adult instead of the child will sort separately, and they will have an icon that indicates this. It is also worth noting that a patient will only show up in the toolkit of the clinician who last saw them. You can sort your information by clicking on any of the green arrows. You may need to click refresh when sorting. You can edit what items you want to keep an eye on by clicking on the Toolkit User Settings button within the Settings drop-down. This is done using these checkboxes. Unchecking an item will cause it to disappear from your view. The columns will provide valuable information about how your patient is doing with treatment. Also note the clinical message field. If a patient has one of these, you can mouse over it for a diagnosis of their current standing. For a more detailed and individualized look at cases, click on one of the client IDs. This will pull up a graph of how the patient is doing. Once again, you may click on the names of items for additional information about any of these items. The GDS score is generally a good indicator of overall distress, ranging on a 0 to 4 scale. The higher this number is, the more distressed the patient appears to be overall. The purple line is projected change. It represents how people with similar demographics improved over time. The green dotted line is the clinical boundary. People above the green line are subject to more distress and probably need the additional support counseling provides. People below the line can generally manage daily stressors on their own with less needs for support. You may find it helpful to be able to plot additional variables on our graph. It may prove helpful to add self-harm and substance abuse, and see where those are headed. You may do so by clicking the corresponding checkboxes and pressing refresh. This graph can be an excellent tool if you use it. You may find it beneficial to review it with clients to show them improvements or areas of concern. Statistics have shown that clinicians often overestimate how well a client is doing. Because of the nature of sessions of care and human interaction, it is impossible to truly review every life change or concern that a patient may have at each and every session. The Acorn forms will help you collect more of that information regularly, so that you can focus your discussions where they need to go, and still have a very clear overall look at changes and progress that you may have otherwise missed. Statistically, clinicians who closely monitor and utilize the outcomes data of their clients using the toolkit have far improved outcomes over clinicians who do not. You usually should be able to click on the individual session dates listed below to view the original form you submitted. It will also show you any previous treatment episodes. These are episodes of care for this patient that have happened with a long enough gap between them that they are considered to be 2 different treatment episodes. Please note that a client won't begin to populate into your toolkit until you have outcomes forms submitted for them. A client registration form alone will not cause a client to appear in your toolkit. Registration forms are used to provide additional information for more accurate outcomes with the data analysis. This concludes the tutorial. You should now have a basic idea of how to submit and utilize your data and the toolkit together. Remember to log in frequently and track your patient's progress. Clinicians who do this tend to have significantly improved outcomes.